everybody, this is Dr. Kim Crosby at Harmony Medical Spa. Happy New Year to everyone, and I wanted to tell everybody about our January specials, which we are calling the New Year, New You specials. The first one, which is nearest and dearest to my heart, is the Silhouette Instalift. Instalift is a way to non-surgically lift the face or reposition the lower face. This is based on 20 years of technology that started with the contour threads. And contour threads were advertised as a lunchtime lift. They were a barbed wire suture, and over time the barbs or the wires would erode through the skin. They're actually the only cosmetic device that the FDA has approved and then subsequently taken back off the market. So Silhouette was developed by a European company who said, you've got the idea right, you're just using the wrong materials. In 2015, Silhouette Instalift sutures were approved by the FDA based on thousands of patient results from all over Europe, Canada, and the US. And it's really a genius product. So the person that is an ideal candidate for Instalift is women of a certain age, like my age, who catch themselves looking in the mirror and doing this little motion. Oh, if I could just a little, just a half of an inch. And that's what the Instalift will do. It will reposition the lower face for the jowling that we see along the jawline. I love fillers. I'm a huge fan of filler. I have fillers in my own face, but fillers cannot do in the jawline what the Instalift sutures can do. So I've been asked many times, well, what are the difference between Instalift sutures and Nova threads or Euro threads? Because Instalift is more expensive. The main difference is that Nova threads, they're made in Korea. They are basically filler on a string. They have no bidirectional capability, which means they're not able to reposition the tissue. Same thing goes with Euro threads. They basically work by stimulating collagen. So any tightening of the skin is based on collagen stimulation only. There is no lifting capability. When they're put in, it's a little thread that's threaded up under the skin, and where it sits, that's where it stays. So with the Instalift sutures, you're actually able to reposition the skin up and back, which is that motion that we all look in the mirror and try with our lower face, thinking, oh man, if I could just get a little bit of a lift. Now, I will tell you that the limitations of the Instalift is how much lift you get. So if when you look in the mirror, you think, maybe just a quarter of an inch, maybe a half of an inch, then you're in the Instalift territory. If when you look in the mirror, you're thinking, oh, I need a whole inch, then that's a surgical facelift, and that cannot be done with Instalift. So I don't want anyone to get the wrong idea. The other great thing about the Instalift is we can use them right under the jawline to lift the neck and also in the anterior neck. Now, it will not resolve the crepey looking skin, but it will tighten everything up. We know from histologic studies that once the Instalift sutures are put in, they continue to stimulate collagen for 270 days. That's 9 months. So that means over the course of 9 months, the skin continues to tighten. That's a really impressive finding. The Instalift suture, I have one here so you can kind of see. It's on a standard surgical suture, the same kind we use in the operating room all the time. It's a piece of Vicryl suture, and that dissolves over the course of a month or two. But what's different about this suture are these little tiny cones. These cones are made of a 5-year filler called Sculptra, and a lot of people have heard of Sculptra. It's a great filler, but it does have its problems. However, when we put it into a little cone like this, it eliminates a lot of the problems of Sculptra injection, like granuloma. So this particular type of filler, not only is it able to pull up on the skin, but it also stimulates type 1 and type 3 collagen. These are the long branching fibers of collagen that over time they curl up like a little fusilli pasta. So they continue to tighten over time, and that gives you a continued improvement. What we're seeing with our patients is that at about 1 year, post-procedure, most people are thinking that their own appearance is about 3 to 4 years younger than before they started a year ago. So it's a great procedure if you want a little lift. Because of COVID and the limitations as far as who you can be in the same room with without a mask, I have kind of bullied my daughter a little bit into being my model. But this is my daughter, Chloe. She has agreed to be the model, so you can kind of see where the positioning is and exactly how it works. So I'll have you turn your head just a little, sweetheart. So as you can see, I've got a couple little dots right here, which I'll point to using this Q-tip. So this, for instance, would be the insertion site for the suture. And this would be one of the 2 exit sites, and the other one would come out here in front of the ear in the hairline. And the needles look wicked long, but they are very tiny. When you look at them on end, they're super thin. So once she's numbed on her face, what we would do would be to put the suture in here, and this needle would come out down here. Once that one is in, that gives us half of the cones. Then the other end of the suture goes in at the same place, right here, and comes out up here in the hairline, which gives us cones above and below our insertion site. And because of the direction of the cones, as I pull on this end, that wider section of cone will grab onto the tissue and pull up. Now, of course, she's got super firm young woman skin, so it doesn't move at all. But you can imagine for someone my age, let's say in mid-50s, 60s, older, as you pull up, this tightens all of the jawline, the jowling. When we see that little downturn at the corner of the mouth, all of that gets pulled up. The other thing that it does a great job of is this kind of Modiolus right here. It pushes it up into the cheek, so it revolumizes the cheek without additional filler. So this is a great procedure. Right now our special is going to be you buy 6 sutures, which would be like a standard lift, and you're going to get 8 sutures for the cost of the 6. If you're interested, please give us a call. We'd be happy to provide a free consultation and let you know what all the prices and the details are. Most people have about a 1-day downtime. A lot of my clients have found that they didn't really have any downtime at all the day of the procedure. They were a little puffy. They kept ice on it that night at home, and then they were about able to go back to their normal activities the very next day. Our other special, which I will just briefly mention, is a facial, which is a hyaluronic acid mask. Right now it's January. All of us have incredibly dry skin, dry hands, so this is designed particularly for dry skin and to rejuvenate dry skin. Thanks for joining us, and we'll see you soon.